Good afternoon. My name is Karen from the MedStar digital team, and we are live today with Dr. Reginald Robinson, cardiologist with MedStar Health Cardiology Associates. Today we're going to be talking about how diabetes affects your cardiovascular health. Thank you for being here with us today.
You're welcome.
How are you doing?
I'm doing well, thank you.
Awesome. We have a few questions to ask, and we encourage you to comment in the chat below. So if you have any additional questions, we'll be happy to answer them for you. The first question is, what are the major risk factors of heart disease?
Well, some of the major risk factors, as we talk about risk factors, they're preventable or modifiable risk factors and non-modifiable risk factors. So you can't do anything about your genetics. So if you have a family history of cardiovascular disease, that would mean the first degree male relative under the age of 55, first degree female relative under the age of 65. So we all can get some degree of cardiovascular disease when we're in their 70s or 80s, but when you say true family history, those are the parameters you're looking for. Some of the modifiable risk factors, sedentary lifestyle, if you're inactive. Diabetes is a major contributor to cardiovascular disease, hypertension. So, and obesity. You can include smoking as a huge factor as well.
Okay, wonderful. Are there any warning signs that my diabetes is directly impacting my heart health?
Well, you don't want to wait to get warning signs from diabetes, because by the time you get warning signs from diabetes, you have a gangrenous foot getting ready for amputations. Or you're getting claudication, which means calf pain when you walk. You get pain in your calf muscles or fatigue in the legs when you walk. So you're further down the line when you start getting warning signs from diabetes. One of the things you should actually do is follow up with your primary care physician to look at your what's called the hemoglobin A1C. That's a measure of your blood sugar over an average. There's some people that will take their blood sugars on a daily basis, so that'll tell them what their blood sugars are on that day. But the hemoglobin A1C, that's a blood draw that your primary physician would check to see actually how you've been doing. You can cheat a little bit on your daily blood sticks, but once they actually draw the hemoglobin A1C, that'll give an idea of how well you've been controlled.
Okay. What is the difference between type 1 and type 2 diabetes?
Well, the terminology changed many, many years ago. They used to call type 1 juvenile onset diabetes and type 2 adult onset diabetes. But now we see more and more juveniles that are obese that have diabetes. So that term's not that we discarded that term a long time ago. So type 1 is your body's not producing enough insulin. That comes from an organ called the pancreas to help you utilize the blood sugars that are going through your body. Type 2, you have insulin, but you're more resistant to that insulin. And that's why we see a rise of type 2 diabetes now, because we're getting more obesity. So it's central fat that's important. The more fat you have around the abdomen, that fat is actually active. And that fat is actually making you more resistant to your own insulin. So there comes diabetes. So we're getting more and more younger people that develop diabetes because of the obesity. And that might be a generation that may not outlive their parents because they get diabetes earlier, they get the chronic conditions from diabetes, hypertension, sleep apnea, peripheral vascular disease, heart attack, stroke, leading up to dialysis and amputation.
Okay, thank you. The next question, can I prevent cardiovascular disease if I have diabetes?
Sure. 80% of the disorders that we deal with are modifiable. I'll just repeat that part of it. 85% or more are preventable from what I call TLC. When I talk to my patients, I talk about TLC. And that's not total tender loving care. In a sense it is, but it's more about total lifestyle change. And if you change your lifestyle, meaning getting more active, less sedentary lifestyle, better diets, following up with your physician, and doing those kind of things, that's the most important part of trying to prevent cardiovascular disease, because the majority of the things that come from diabetes, they're usually asymptomatic, not having any symptoms at all. So you want to actually do those lifestyle modifying factors first, and then following up with your primary physician.
Okay. Another question about type 1 and type 2 diabetes. Do they have the same impact on my heart health, or are they different?
Yes. Yes and yes.
Okay.
They do have the same impact. The longer you have, when you have type 1 diabetes, you tend to have it very early in life. So you've had it over 20, 30 years. And that blood sugar, if it's not controlled, you have increased risk of becoming blind. I have young patients that have had type 1 diabetes that didn't have good follow-up, whether it's because of some kind of healthcare disparity, or they just didn't have good access to a physician, or they just felt that they were young and didn't need to follow up with a physician based on their blood sugars. And they developed these problems earlier on: foot disorders, peripheral vascular disease or poor circulation, heart disease earlier, or ending up on dialysis. Type 2 diabetes, you tend to develop it later on, but we talked about now we're getting more and more younger people with type 2 diabetes, so they're developing those same complications. So when you look at diabetes, you should consider it as a cardiovascular equivalent, meaning you have the same 20% 10-year risk of having a cardiovascular event, meaning stroke, heart attack, ending up on dialysis.
Okay. What lifestyle changes can I make that will help me live a heart-healthy lifestyle?
Back to my TLC, right?
Mm-hmm.
Total lifestyle change.
Yeah.
If you look at the kinds of foods we eat, or the behaviors or the lifestyles we have, we talk about genetics as a risk factor, but there are sort of genetics meaning that you learn how to eat and live from your parents. So you take that genetic, not the DNA and RNA, but just how you learn to eat, how you learn to live stressful lives, how you learn to, not try new things in life. So we have to modify that aspect of our genetics. And that's an initial start. That's a big start. It's easy to give someone a pill for hypertension or for diabetes or for high cholesterol. It's harder to actually say, I'm going to get up 10 minutes a day to do some kind of walking or activity. 10 minutes, that's sort of cheating. But most people can do 10 minutes of something. Even if I'm sitting at my desk, I can stand up and down to work my quad muscles, or stand up and down on my tiptoes to work my calf muscles, or even just walk and take the stairs versus waiting for the elevator to go up to the first floor. You'll see a lot of people that are just waiting for the elevator and they're just going up to the second floor.
Right.
You can incorporate, if you work on the third or fourth floor, get off on the second floor for the first week and walk up those 2 flights. And each week, as you're building up your muscle endurance, you'll be able to build up your muscles. You'll be able to start walking from the first floor on up to the 4th floor, or to the 5th floor, or to the 6th floor.
Okay, really, really great advice. Thank you.
Mm-hmm.
When should I see a doctor if I have diabetes and I'm concerned about my heart health?
Well, the primary physician should be the quarterback of the team when you're talking about diabetes care. Some patients may see an endocrinologist. That's a specialist that specializes in diabetes and other thyroid or endocrine disorders. But for your routine follow-up, you certainly have to go in for a yearly follow-up. It depends on how severe your diabetes is, how other organs that may have been involved from the diabetes, that you may have to follow up more frequent to check your kidney function, to check your urinalysis. That's one of the earliest stages of kidney dysfunction that can be picked up by just checking the urine. When you go see your primary physician, you'll start seeing protein in the urine. And that's telling you that you have some early damage to the kidneys. You won't feel that, but it can be detected by doing a urinalysis. You can look at your kidney function also by checking a blood test called the creatinine. And when you look at that with your routine blood draw from your primary physician, that can be an early indicator of the diabetes effect on your vascular system.
Mm-hmm. Okay. Lots of great information. Thank you so much.
Welcome.
That's all the questions we have for today. Thank you so much for joining us on Facebook Live. If you'd like to make an appointment with Dr. Robinson, please call 855-338-3819. Thank you so much.